Thank you very much, Mr. Chair. I recently heard in this room, and I've heard this before, about the pandemic being politicized. And if the left didn't politicize the pandemic, can someone help explain to me the science of Democrat governors lifting mask mandates for adults, but not for children in schools, or them posing with children in schools completely masked, even though they have low levels of transmission, almost infinitesimally low levels of illness or death, but yet the lawmaker being unmasked? I didn't think so, because there is no science that would support masking children with adults unmasked. Having said that, I'd like to thank our witnesses for coming before us and sharing their testimony today. Mothers disproportionately shouldered the responsibility for children during remote or hybrid schooling and daycare disruptions. Many are unable to return to the workplace because at any given moment, their child's class, school, or child care facility could be shut down over a single positive COVID test with no illness. In January of 2022, the male labor force participation rate was up to 70%, while the female rate was just at 58%. This is likely related to the fact in early January of 2022 that there were nearly 7,500 school closures due to the Omicron surge, even though we knew that there was little risk of illness. Ms. Lucas, how has the instability in school and daycare systems contributed to women's exodus and continued absence from the workforce? And how can we get women who choose to work back to work?
Yeah, you know, it's interesting because there has been a drop-off in both men and women's labor force participation and with children, but it's actually the labor force drop-off has been larger among among parents of kids, school-age kids, not in this child care in the 0 through 5, which really is the focus of this hearing. Which we do need to make sure we absolutely need to make it easier for more child care centers to open, so that people do have those options. Make child care, reduce regulations, end the kind of forced closures and the really expensive, disruptive policies that have made running a daycare center so difficult. But again, I think that when we look at the real problems with labor force participation, a lot of it is driven not by the lack of childcare. It's about the total undependability of our public school system, particularly in Democratic states where the schools remained closed for more than a year.
According to emails obtained by the Americans for Public Trust, the American Federation of Teachers was provided a pre-release copy of the CDC's updated school guidelines in February of 2021. The pre-release version of the guidance, written prior to the influence of the AFT, stated that schools could provide in-person education regardless of the community transmission. And in fact, in Iowa, Governor Reynolds opened schools to in-person learning in the fall of 2020 without significant consequence of illness or transmission or super spreader events. Unfortunately, the CDC bowed to the pressure of the AFT, forcing thousands of schools to remain virtual. In fact, the AFT's exact suggested language appeared in the CDC's final guidance. Ms. Lucas, do you think it's fair that the teachers' union had the ability to edit the guidance?
No, it's absolutely appalling, and I do think it's a really it's a clarifying moment in us seeing one of the problems with how children have been treated as pawns during this pandemic, and really opened our eyes to the problems that are inherent in our public school system, which did not prioritize children, did not prioritize families during this pandemic, and why we need to change. We should not move in the direction of moving towards a public-funded and government-controlled daycare system. Instead, we should be thinking about how to liberalize and how to give parents more leverage over our public school system so they would be more responsive, care more about children's mental health and development, and not really and not sacrifice them as they did during COVID.
That is so well said. Democrats unfortunately chose the teachers' union over teachers who wanted to return to school, parents, and most importantly, children. Now we are seeing the effects of their harmful choices. America's children are broken. Do you agree? And shouldn't the CDC base its guidance off science?
Absolutely, and I do think it's interesting. We'll be learning about this in years. We'll be having conversations about the lasting damage that's been done due to school closures, the increased mental health problems for not just for little kids who are forced to mask and are still masking today in Head Start programs and in many daycare centers, but that have affected preteens, vulnerable. I know among my kids, I feel the worst for my middle-aged children at such a hard age, and I think this has made it just incredibly worse. So we'll be seeing this for years to come, sadly.
Yeah, and the spiraling level of youth suicides. Thank you so much. Mr. Chair, I yield back.